Hello, everyone. This is Maritza Duran, and today I have a very special new friend, I should say, who reached out to us through our Facebook group and posted a question that I thought would be helpful for not only him to receive some feedback and some like brainstorm on ideas on how to improve that particular issue within his practice, which is how do I maintain a fee for service essence to my practice when patients are asking me to use their insurances. How do I make tapping into the benefits of my patients as a fee for service out of network provider without falling into the trap of you know changing my business model? So I'm really excited and grateful to have Dr. Shakally with us here today. We decided to do this hot seat setting where he posted a question. I'm going to go ahead, and before I let you introduce yourself, what the question was on the Facebook group. And from there, we are going to, have a conversation. And I'm hoping that he can walk away with some ideas on how to fix the situation. So, he posted on the dental startup journey group. Happy Saturday, everyone. I have a question about submitting out of network benefits for patients. Startup practice owner here. We've opened our doors a couple of months ago and things are going well. We've completely been fee for service so far, not even submitting out of network benefits for patients. I will go out of business before I go in network with any insurance, but more and more patients are asking us to at least submit their claims to insurances for out of network benefits. I have no experience with this and I'm not interested in adding a new team member just to do this. What is the possible option for me? How much time and energy is actually required to do this? Is it better just to have patients try to do it themselves or outsource it somewhere else? So that was the question. And I will let you tell us a little bit more about you, your journey, and rephrase those questions so that we can answer those live.
Sounds good. I wasn't really expecting a live interview, but my name is Dr. Monzer Shakally. I graduated 2 years ago now from the University of Iowa. I was born and raised in Syria and moved to the U.S. as a refugee 11 years ago, almost. Finished up high school last year, high school and undergrad at Iowa, dental school at Iowa, and then moved to Phoenix, Arizona. Worked my first job at Pacific Dental for about 5 months, and then worked at a more of a regional DSO close by here for about a year and a half, and I finally started my office here in Phoenix. It's a startup, and it's situated in an area where a lot of people are either undocumented immigrants
Mm,
or work much more, contractors or hair salon owners or roofing contract, odd jobs, not as much of they're not people working at Intel. So not as many people have dental insurance. And for me personally, I don't like the idea of insurance. I think it's a scam. I want to be able to somebody. I mean, the practice's mission is to provide quality care at affordable prices, and I
okay.
think insurance just negates both factors. Um, I did a lot of, I thought a lot about it before when I was, trying to start it. Which way I want to go? Do I go with PPOs or Medicare? Because a lot of people around here are on access.
Okay.
I decided then I'm just going to do fee for service and keep the prices low and
Okay.
kind of target those specific individuals. And if it works, it works. If it doesn't, then I'll switch out of dentistry because I'm not working with insurances. That's kind of the end of my um, it's the reality. I'm not. I'd rather switch out of dentistry than work with insurances.
I see. So you have chosen to start your own practice, and congratulations, because I think your journey and your background is just very inspirational, and for you to make it this far and be able to start a practice and your own business, that's something that I give you a lot of credit for that. Now, in order for me to help you, and I can help you with the logistics of how to handle the task at hand, which is to resolve the question to your current patient population that it's inquiring about participate, I mean, being able to tap into their benefits. But before we go into that, it seems that you've analyzed your audience and you know that, hey, this is going to be a population that they don't, for the most part, have dental coverage to begin with, right? So we're talking
Mhm.
about, like, I'm Hispanic, I'm from the Dominican Republic, I'm an immigrant myself, so I can totally relate. We have different niches or different patient demographics that have different needs,
Mhm.
and or different ways of covering their, medical and dental um, needs, so to speak. And so when we're talking about contractors, again, these are people that they're maybe, working for a company, or maybe they're working, they are the business owner, but they don't necessarily could purchase an expensive policy for themselves. So they're likely willing to come into a practice where they can get services done, and just be done with it. So what are some of the things? Tell me how your office is doing. For how long have you been open? I know that you decided to open a practice in this particular location, and you know that the population does not have dental insurance, and you have been able to cater to those patients. How are the patients getting to come to you, and how is your pricing to make it, affordable enough for them to decide to come and work with you as a fee for service practice?
I can run the numbers exactly for how many patients. I mean, the I took over the lease on March 8th, so it's about 3 months ago.
Okay.
But I wouldn't say I started for a month after that because I had to get computers and find a team and
Okay.
all that. So the month after was just getting inventory in place.
Okay.
Marketing started May 11th, so
May 11.
it's been about a month and a half.
So it's been pretty new.
Correct.
Okay.
Um,
And have you run your numbers as far as like your break even number,
yep.
and okay. So how many patients do you need to see on a given day in order for you to cover costs? Your hourly overhead
I don't know about
expense.
how many patients. It depends on what each patient needs, but my break even cost is 1,100 a day. So it's a
Okay.
pretty lean and mean office.
Okay.
I didn't spend $1 million on it. It's only 3 ops.
Okay.
So from the get go, it's not an office that can support a Medicaid based practice where you have, 17 different ops and, 5 hygienists and 2 associates. It's not that. I don't even
Okay.
have a hygienist here. I'm doing.
Okay. Yeah, and it's relatively new. And so I think you're taking it one step at a time, which is great. So this is, I'm gonna give you sort of like the same call that I have with my clients, post opening. So one of the things that I always ask my clients is, we have the revenue projections and the number of new patients based on the hourly overhead and all of the pricing and everything set up prior to opening. And then we have our targets before we open for business. And we monitor how many patients are coming in, and the breakdown of the services that you're getting done. But I'm discovering, because it's the first time we're having this conversation, what is your new patient special, for patients that are coming in, like right now as a fee for service practice?
I would say, I mean, we offer free consults. So
Okay.
patients are coming in. I can run numbers for June, but I think so far, 27 new patients for the month.
Okay, that's not bad. Okay.
Um, I would say a third of our patient comes from the marketing company that I'm using. A
Mm-hmm.
third comes from word of mouth.
Awesome.
Patients are referring each other, and then the other third, we are open on Friday and Saturday.
Okay.
So patients are either self scheduling on the website or they're walking in as emergencies.
Awesome.
We offer free consults. We have my in office savings plan, so almost
Beautiful.
everybody has to signs up for it. I have it priced in a way that so like you know this is what it looks like.
Okay.
So
Nice.
we have, everything in our office, it's in English, then in Spanish, and then here it has like our um, map, and then
Beautiful.
uh, you know
You
everybody,
have
if
your
you refer
QR code.
somebody,
Okay.
if you refer somebody, they get $50 credit, and the person that referred them gets $50 credit. So we are getting a lot of that. I don't know, we're up to like 52 5-star reviews so far.
Beautiful. Yeah, that's great. So you're getting a lot of patients referred internally, which is great. Um, you have an in-house membership program, and that's okay. You can do your thing, which
We
is
have,
good.
we offer financing to everybody as well.
Okay, perfect. So the question became, so I feel that everything you're telling me, you're on the right track. You have the right systems and things happening in the practice, and it's pretty healthy if you're getting internal referrals, if the website is working. So those are all good things. The pricing structure, as long as it meets your hourly overhead expenses for, like, a patient that comes in and doesn't necessarily need anything, like once they come into the practice, they're going to need certain services, or you're going to sell them into the in-house membership program, or they're going to have some same day services, then that's great. But if you are going to have a lot of advertisement, are you in between patients?
No, we're on lunch break, but
Okay, perfect. So we'll make this quick because I want to get to the point, that way you can share it with your team. So the patients come in, here are a couple of things that I want you to keep track of. You're getting a good chunk of new patients coming in. What has been the number of patients out of the 27 that have needed treatment, that have scheduled their second visits and have come to the visits and enrolled for the program?
uh, I'm not sure I understand the question. How many of those new patients
You had
have
27 new
scheduled?
patients,
Yeah,
and out of those 27, you had an incentive that were free consultations. And then some of them
right.
came in, took advantage of the free consultation, and the team was able to get them enrolled in the in house, like membership program. And some of them needed to have treatment done. So I want to know if you have already metrics for how many of those new patients that came in, the breakdown of those 27.
The breakdown of those 27 is depends on which source they're coming from. If they're coming from referral, internal referral, all of those internal referrals are getting the in-office savings plan. If they're coming in as emergencies, um, all of them got the treatment done.
Okay.
But usually we get, in terms of emergencies, most of them are going to be extractions and bone grafts or root
Okay.
canals. So there's always going to be a follow-up appointment associated with them. That's when I talk to them about the in-office savings plan. I try not to talk too much. I present it, I talk about it a little bit, but the next appointment I talk to them about getting an office savings plan. I don't know exact numbers, but it's pretty high. In terms of the consults, I have the tracker where it goes from somebody commented or responded to the Facebook ad, somebody scheduled, somebody showed up, somebody paid for treatment. So it's a funnel.
Yes.
um, I know that the company is generating about 2x returns so far in terms
Okay.
of ROI,
Okay.
which is still low, but like I said, it's the first month and a
It's
half
yeah,
into it.
it takes a little
So
time for it to
Like,
work.
yeah, everything is working out well. My main question is just out of those 27 patients, there is, like I said, my price. There's a lot of people that come in with insurance and they
Hmm.
either decide to drop their insurance. We've had maybe three so far that
Okay.
signed up. They had insurance, they decided to drop their insurance and signed up for the savings plan. There's
Okay.
two patients that do have insurance, and they just decided to pay out of pocket for those
Okay.
services.
Okay.
But there was just one patient that was just asking like, hey, I have my insurance, is there any way you can help me at least get reimbursed? So I was like, I'm not going to get in network with these insurance companies, but let me see what I can do. Let me see if there's any way I can get you some money back. And I was just trying to explore that. It's not.
Okay.
So I was just saying, I mean, I'm not going to go, like I said, I'm not getting into be a preferred provider, a PPO
Yes.
provider for any of those networks. I'm not gonna I'm not gonna be involved with insurance verification and submitting claims and denials and collecting half from the patient and half
Yes,
whenever
you're not going to coordinate benefits. You're
I'm not
not
gonna
going
go into
to do
that.
the
So
insurance verification. You are just, and that's why I said, this is why I know that you want to maintain the essence of your business model, which is extremely important, and the way that you manage the relationship with the patient is going to make the biggest difference. So the patient already understands this is a fee for service practice.
correct. We don't
What
make it like, oh, we'll maybe submit. No, this is we don't take any insurances. Our prices are just much,
Okay.
very affordable.
What insurance is this that the patient is referring to? Do you know it
I
from
took
the
a picture. I think it's Cigna.
Okay, okay. Perfect. Okay. So, I'm going to give you the logistics of what you need to do as a startup in order for you to do any form of billing. Now we have three things that are happening here. We need the I'm sure you already have a software, and the software you're going to need to enter the patient's information. That's one thing. The other is the conversation. So as far as the conversation with the patient, they're coming in with the understanding this is just a courtesy submission on your behalf for you to get refunded or reimbursed. Now, in order for you to do that, you're going to need to what's the software that you're using?
Dentrix Send.
Dentrix. Okay. So with Dentrix, as with any software, you're going to wait until the patient comes in or afterwards, and you can just basically say, hey, what is the information? Who's the subscriber? And enter that information onto the software. From the software, you're going to need to then either print the claim and mail it out to the insurance company, or you can actually use a clearinghouse, which allows you to electronically submit the claims. Okay, that's what's happening in the office now. When a when a new tax ID is rendering services for one of their members, in network or not, because of HIPAA regulations, once the claim gets received, if they have no record of that provider, the claim most likely will be rejected. And then
Mm.
you're going to have phone calls from the patients saying, hey, like, where is the payment? Your office agreed to submit it, and so on and so forth. And although you are not, you're not staying committed to doing the submission, it's just like a transactional thing just to help them out. Number one, always make sure that you submit a W-9 to the insurance company in question, because it is similar to when you are starting a new position, and you're pretty much just filling out a W-4 if you're going to be on payroll, or a W-9 if you're going to be a 1099. The insurance companies are going to issue a 1099 at the end of the year for any payments that they make out, whether it's to you or to the patient. So the first step is for any claim, and what you can do is you enter the insurance information with the claims address based on the patient's insurance card onto the software, and you can print the claim, hand it over to the patient, and let them submit it. On the claim itself, there are different sections of the procedures that, as you enter the information, is going to populate the claim. And there's a section that says assignment of benefits. On the assignment of benefits section of the claim, you're going to not sign it or do signature on file or anything, because you want the patient to get reimbursed. If you sign that, it's if the patient with their out of network benefits have assignment of benefits to out of network providers as part of their benefits, the payment will then come to you, and you would have to refund it back to the patient, and you don't want to get into that. So first step is setting up entering the information into the software, printing out the claim, and on the claim, if you're not going to have a clearinghouse, what are your thoughts? Are you thinking about getting into a clearinghouse? If you want to maintain kind of like your costs down, I would say create the clearinghouse. There's going to be a fee associated with that.
Mm.
With you setting up a clearinghouse, which is kind of like submitting the claims electronically to the insurance companies, even as out of network, there is a fee to you for the submission. So I would say, number one, have your W-9 readily available. Have the team after the patient gets treated, not during the call. And I think that you have a very, very strong sense of how you're handling out of network, and it's great because you're very clear on your vision and what you want. So it's just, if they bring it up, sure, give me the insurance information. I would plug it into the software, print out the claim, and you can just forward it to the insurance company on your own and what have you. Now, where it gets tricky is, I'm not sure if you are following the office private fees and then separately you're giving them a discount for the services. Whenever you're billing an insurance company, whether it's for the form of reimbursement or you're out of network, a lot of offices get into the idea that they charge. Like, I had a patient, to give you not a patient, a doctor few years ago that had an in-house special of like 59 for for like a promotional period. And when she was generating the claims for the patient's reimbursement, it was like $400 when she entered like the itemized procedure codes, itemized one by one. They all added up to that amount. So she reached out and she said, Maritza, like, why, like, the patients are getting paid more than I'm collecting. Is that right? And I said, no, that's not right. So if you charge the patient $40 for an exam, make sure that you break it down so that they're getting refunded on those $40. Because otherwise, the insurance companies, whether you're in network or not, are going to consider it fraud if you're overbilling them and under collecting from the patient. Does that make sense?
Mm-mm.
So if I am the patient and you are the fee for service provider, and I'm getting a crown done by you and you're charging me $500 because I'm part of your, like your discount in-house program, but your private fee, it's $1,500. When you generate a claim, most softwares are going to pick up your office private fees, which could be the 80th or the 90th percentile. What happens is, if I'm getting reimbursed and I'm only paying you $500 and you're billing my insurance for me to collect, the insurance company is going to look at what you're billing them as what I paid you. And if
Mm-hmm.
your private fee is $1,500 and that's what you're submitting to the insurance company, I may get paid more than this, depending on the policy that I have. If it's a decent policy, I may be able to get more than the $500 that I paid you.
Mm-hmm.
And in the insurance eyes, you're committed fraud because you're billing them more than than you
Gotcha.
accepted from their member. Make sense?
So the easiest way to go about this is basically to print them the claim form and give it to them. Tell them, hey, you reach out to your insurance, talk to them, and maybe you can get reimbursed, maybe not.
Exactly. So if that is your model and that's how you want to approach it, then it's just a matter of, you can even print a like a just the procedures without the claim. Like, you can generate a claim from the software without entering their insurance information, and just highlight the sections where it's their portion of like the claims address. And but they need your tax ID information in order to have the claim process for their reimbursement. And that's where the W-9 from your practice comes in.
So how do I? So the W-9. Do I need to reach out to the insurance companies and ask them to, hey, I need to submit a W-9. I need to be a network provider with you guys.
So that is typically for most of the offices that we help that are like fee for service, just for the sake of whether or not they want to accept the out of network benefits or do the billing for the patient's reimbursement. You do want to submit your W-9 just to facilitate for the out of network billing and for the claims not to be rejected once they are received.
Mhm.
Okay.
So does that
And
mean I need to reach out to each individual company and tell them, hey, I need to submit a W-9 for you, or how
yes.
does that
So
work?
I would say that my rule of thumb is the rule of five. Like, every dental practice has about five insurance companies that are the most prevalent on your schedule. You go through your schedule, and because you are going to be treating patients from certain number of employers from within each insurance carrier. And so Delta Dental is usually pretty big, or Aetna if you have like
But from my understanding is Delta Dental doesn't do out of network benefits.
they do, but some policies do, some policies don't. The
Yeah.
ones that do, sometimes they have, it's like on the case, it's an employer specific, setup. Some
Mm.
employers allow their employees with Delta Dental PPO policies to have in and out of network benefits and accept assignment of benefits to out of network providers, meaning that they will be willing to send back the payment to the out of network provider. Some policies with Delta Dental that some employers purchase will have no out of network benefits, or like the EPOs, like exclusive organizational provider. Um, so those, it's, like that's where the insurance verification comes into play, and that's what you're trying to avoid. And
Right.
so the communication with the patient is, I don't know how your policy works, but here's the claim, and your insurance will determine how they want to cover the claim for services rendered at my practice based on the policy.
Do you have any practices that are completely fee for service, not billing anything out at all? Probably not, right? Because they wouldn't be
It's
reaching out to
very,
you.
it's very rare. Like, yes, I have some like in New York City, I have a practice in Georgia, but a lot of times you do want to help the patients, and there's nothing wrong with that, because it's
I
like
mean, I
a
want to help the patient, but I don't want to help them at the expense of my sanity.
Well, I think that your sanity as a business owner comes also from your ability to add value to the patients, and again, if you are very successful, like, because we go through stages in our businesses, right? Like, we start off and we have to be flexible, and once we are positioned, once we are in a good, financial situation, then we can pick and choose. But for the meantime, you want to add more days for your employees, and you want to be able to, continue to make it easy for the patients to spread the word about you. Because look at it this way: I had a patient, a doctor once, that was in the network with an insurance company, but the patient didn't have um, a benefit of like a second exam, like a limited exam. And this is where mindset comes in. I don't know where you are. I love that you are set on your business model, but a lot of times you have only been open for 3 months. I would say that if, unless you're covering costs, you're profitable, and your team is working all the hours that they want, and you're competing with the DSOs, and like everything that you want for you and your team you already accomplished, then by all means, just don't even bother with billing at all the insurance companies. But if that's not where you are, at least for the first 6 months to a year, you open a practice, and the patients, to a certain, like, the market determines the changes that we need to make to our businesses so that our businesses could thrive. Does that make sense?
Yeah. Mm-hmm.
So when the question comes, do you have providers that are completely fee for service? Yes, but they go through a transitional period where they are flexible, and then as they grow and they reach certain milestones within their businesses, they scale back. And they start as a fee for service practice, doing what I'm encouraging you to do. If you're getting patients asking, would you bill my insurance? Make it easier for them. Let me share this one last story with you before we wrap up. I was introduced to a dentist in Connecticut, in a very affluent area. She had been in practice for over 30 years. She was a complete fee for service practice owner. This was an orthodontist. And she said to me, Maritza, I'm having an issue because I have been treating my patients, and now the siblings of some of my patients are not getting the treatment done with me. And I am I'm thinking that the reason why is there's so many other dentists that are accepting the insurance. Number one, because they have insurance, I need to teach my team how to do the billing. So a dentist that had been established and grown her practice for like 25, 30 years found herself in a situation where the market was telling her, hey, we love you, but we are trying to save, and so we have siblings or the kids of their what have you, the former patients, going someplace else where they can tap into their benefits. And she reached out to me so that we can train her staff to be able to do the out of network billing so that she can retain those patients, because now she was competing with a bunch of other dentists and she was losing her market share. So this is a 30-year-old practice versus a 3-month-old practice. You have patients coming to you, you're building your reputation, they're loving you, they're signing up. they're referring their friends and families, you're doing something right. Now, if they're asking you, can you bill my insurance? Don't turn them away over the, like the peace of mind for you, because you got into the business so that you're not going to have peace of mind for some time. You know what I mean? That's
Hmm.
my unsolicited advice. And, like, I don't know.
Yeah, yeah. I mean, I have to think about it. I don't really have a lot of people that are asking me to help them with that. I don't know if it's just too early or. And to be honest, that patient that was asking me, I was gonna call and dismiss him after this call because he's just been such a unpleasant person to deal with. So, um, yeah, I'll have to think about it. I don't know. I mean, what can you help me with if we were to start a relationship? Would you just kind of guide me through the whole process, or what
So,
is?
so I'm happy to share with you resources. I mean, I think that um, based on like, I typically work with my doctors pre-opening. We create the entire plan for them, and once they launch, we already have like that blueprint and that understanding of the business structure, and so you are past some of the stages and the milestones that I like to do. Like, I used to do a lot of insurance contracting. And negotiations and so on and so forth. I don't do that anymore. To your point about like, you start off with serving as much as then you find your niche and what you're passionate about, and you start to exclude and include some of the services that you envision yourself doing more of. And that's where I am. So the doctors that come to me, that I'm an open book. I have, if you want the resources for, submitting some of the out of network information and the all of that, I'm happy to do that. Again, if you're looking to do like like a revenue blueprint or something like that, to find out like, hey, what's the best structure for me for the first 6 months and then transitioning
No,
later on,
I mean
then that's a different
the
story.
structure that's best for me is the one that I'm doing because it works. It's
Exactly.
working for me.
Exactly. So if your only concern, I have nothing to offer you as far as like, like services to work with you, just my advice. And my
Mm,
advice is, I just share with you how to the logistics of you submitting out of network for patients, should you choose to do so, because it is your baby, and you are the one who sets the, the standard and the essence of your business model.
right.
If you need any resources, if you decide, I'm happy to share contacts and information so that you can have some of those, who to send out like the W-9 to or what have you. And I would recommend that you do it based on the case to case basis. Like Cigna
Okay.
will be the first one. You do it for Cigna. Once you do it once for Cigna, you don't have to submit a W-9 anymore. And just maintain it in the back packet just in case patients do need it. Test it out with this one patient if you don't want to dismiss them, and see if there is more opportunity in terms of treatment rather than just this initial claim, the lifetime value of that patient. Then consider it, test it, and if you don't like it, you can just discontinue doing it, don't do it again. But if it works out, you're opening up the doors to be able to do more treatment and for them to agree to more treatment, because at least they're getting some help financially on the back end if they have dental benefits. Fair
Mhm.
enough?
Yeah, makes sense. So yeah, if you can maybe help me with just this one first case, see what's all involved.
100%. So shoot me an email, and I'll put you in contact with someone from my team so that they can walk you through like the contact person and where to submit it and so on and so forth.
Okay.
And thank you for reaching out, and
All right.
congratulations on
Thank
your
you. I
journey. I
appreciate it. Thank you
appreciate
for
it.
your talk. I'll
No
send you the
problem. Enjoy
Have a
the
good
rest of
day.
your day. Take care.
Bye.
I'll see you. Bye bye. And for anyone else that wants to be on a hot seat with me and has any questions about how to start a practice, how to get your office off the ground, and how to scale your practice, shoot me a DM. This was Dr. Shakally, and we just spent the last 30 minutes having a discussion about best practices for doing out of network billing as a startup, so that you are continuing to have your essence and your standard of care and your business model while you're dealing in the world of insurance. Thank you guys, and for joining me and for your patience, and I look forward to seeing you in another video. Until next time.